Om Dhanvantaraya Namah. Good afternoon all. Myself, Dr. Chaya Hulle, Assistant Professor, Department of Roga Nidana, Gramina Ayurvedic Medical College, Terda. I welcome you all on behalf of Sri Bahubali Vidyapeethas, JV Mandala, Gramina Ayurvedic Medical College, Terda, District Bagalkot, Karnataka, who has clubbed all of us for the second day of 6th National Webinar on AYURVATA CHINTANA 2020 from the Department Roga Nidana Evam Vikruti Vignana. Prayer is the most powerful tool mankind has to reach the God. It gives us strength and confidence. So now I call upon our students for invocation. Thank you for prayer song. Now I request Dr. K.B. Kulur ma'am for welcome speech.
Hello, good afternoon to all. Myself, Dr. K.V. Kulur, Assistant Professor, Department of Dravaguna, Gramina Ayurvedic Medical College, Terda. Sri Bahubali Vidyapeethas, JV Mandala's Gramina Ayurvedic Medical College and Hospital welcomes you all for second day of 6th National Webinar on AYURVATA CHINTANA 2020 from Department of Roga Nidana and Vikruti Vignana, Gramina Ayurvedic Medical College, Terda. It gives me great pleasure to give a warm welcome to our chief patrons of this webinar, Sri D.C. Patil sir, Chairman, Gramina Ayurvedic Medical College, Terda. Welcome you, sir. Dr. J.B. Algur sir, Secretary, Gramina Ayurvedic Medical College, Terda. Welcome you, sir. Sri Nilesh Jetai sir, Treasurer, Gramina Ayurvedic Medical College, Terda. Welcome you, sir. P.N. Desai sir, Member, Gramina Ayurvedic Medical College, Terda. Welcome you, sir. I cordially welcome our beloved Principal, Professor and HOD, Department of Panchakarma and President of this webinar, Sri Dr. L.M. Biradar sir, Gramina Ayurvedic Medical College, Terda. Welcome you, sir. And also heartily welcome to our Organizing Secretary, Dr. Chetna ma'am, Associate Professor and HOD, Department of Roga Nidana, Gramina Ayurvedic Medical College, Terda. Welcome you, ma'am. On behalf of entire institute, I would like to welcome our eminent guest speaker, Dr. Madhav Diggavi sir, Professor and HOD, Department of PG Studies in Kaya Chikitsa, Taranath Government Ayurvedic Medical College, Ballari. Welcome you, sir. A genial welcome to teaching, non-teaching, hospital staff and students of Gramina Ayurvedic Medical College, Terda. Welcome you all. I extend a gracious and inclusive welcome to all the faculty members, practitioners, UG students, PG scholars of different colleges, and audience from different parts of the country. Welcome, one and all.
Thank you, ma'am, for welcome speech. Greenery gives pleasure to eyes. Now I request Dr. J.B. Algur sir, Secretary, Gramina Ayurvedic Medical College, Terda, P.N. Desai sir, Member, Gramina Ayurvedic Medical College, Terda, and President of this webinar, Dr. L.M. Biradar sir, Principal, Gramina Ayurvedic Medical College, for watering plant. Thank you, sir. Let us start third session. Now I request Dr. K.V. Kulur ma'am to introduce our today's guest speaker, Dr. Madhav Digavi sir.
I'm very happy to introduce Dr. Madhav Digavi sir. Dr. Madhav Digavi sir is an eminent personality in the field of Ayurveda. Sir has completed BMS degree from Ayurveda Mahavidyalaya Hubli and MD from Institute for Postgraduate Teaching and Research in Ayurveda, Gujarat Ayurveda University, Jamnagar in 1998. Sir is currently working as professor and HOD Department of PG Studies in Kaya Chikitsa, Taranath Government Ayurvedic Medical College, Ballari, and has 22 years of teaching experience, and sir has published 3 national and 10 international journals and has been invited as a resource person to various CMS and seminars. Sir has also done research on Vajikarna in Uttarabasti and has successfully treated 90,000 patients with Ayurveda only. With this brief introduction, I request Dr. Madhav Digavi sir to start with the session. Over to you, sir.
भूमि गुरुकुल की, एक ऐसी भूमि गुरुकुल की, जहाँ ज्ञान की निर्मल धार बहे, सेवा सुमिरन सत्संग विद्या प्रभु भक्ति का प्यार बहे। एक ऐसी भूमि गुरुकुल की, जहाँ ज्ञान की निर्मल धार बहे, सेवा सुमिरन सत्संग विद्या प्रभु भक्ति का प्यार बहे। जय जय गुरुकुल।
Excuse me, sir. Dr. Madhavi Dipali, sir. Good afternoon, Dr. Madhav Digavi, sir. Welcome you on behalf of Sri Bahubali Vidyapeethas, Grameen Ayurvedic Medical College, Tirtha, for the second day of 6th national webinar on AYURVATA CHINTANA 2020. Over to you, sir. Sir, not audible, sir.
Sir, your slides are visible, sir. Hello, sir. Hello. Sir, your slides are visible, sir.
Hello.
Sir, it's audible, sir. Sir, can I audible, sir?
Hello.
Hello, sir.
Hello.
Your voice is audible, sir.
Hello.
Yes, sir.
Hello.
Audible, sir. Hello.
Audible? Is it audible?
Yes, sir. Audible, sir.
Shall I start?
Yes, sir. You start, sir.
Hello.
Sir. Your voice is audible, sir, but slides are not visible, sir.
Sound ಬರ್ತಾ ಇಲ್ಲ ಮೇಡಮ್. Hello. Is it
Sir,
audible?
your
I'm not
yes, sir.
audible.
Yes, sir. It is audible, sir. Sir, am I audible now, sir?
Hello. Hello.
Hello, sir.
Hello.
Yes, sir.
Hello.
Sir, am I audible, sir? Hello.
Hello. Is it audible?
Sir, audible, sir. Sir, your voice is audible, sir.
Hello. Hello.
Yes, sir, audible, sir.
ಹೌದಾ, ನನಗೆ ಕೇಳಿಸ್ತಾ ಇಲ್ಲ, ಅದಕ್ಕೆ ಕೇಳಿದೆ. ಬರ್ತಾ ಇದೆಯಾ? ಹೌದು, ಮಾಡಲಾ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ. ಅವ್ರಿಗೆ ಕೇಳಿಸ್ತಾ ಇಲ್ಲ. ಸ್ಟಾರ್ಟ್ ಮಾಡಿ. ಇದ್ರಾಗೆ ನಾನು ಮಾಡಿರಲ್ಲ ನೋಡಿ. ಅದ್ರಲ್ಲಿ ಮಾಡಲ, ಇದ್ರಲ್ಲಿ ಮಾಡಲ. 2 ಮಿನಿಟ್ ಹಿಂದೆ ಸರ್, ಇದೆಲ್ಲ ಮಾಡಿದ್ರೆ ಸುಮ್ಮನೆ PPT ನಾನು ಕಳಿಸಿದ್ದೀನಿ ಅಲ್ಲ. ಇನ್ನೊಂದು ಸರಿ ನಿಮ್ಮ ಮೇಲ್ಗಡೆನೇ ಇದ್ರಾಗ ಓಪನ್ ಮಾಡಿ. ನಿಮ್ಮ ಮೇಲ್ಗಡೆನೇ ಇದ್ರಾಗ ಓಪನ್ ಮಾಡಿ. PPT ಕಳಿಸ್ಬೋದು. ಝೂಮ್ ಮೀಟಿಂಗ್ ಝೂಮ್ ಮೀಟಿಂಗ್ ಮೀಟಿಂಗ್ ಎಕ್ಸಿಟ್ ಆಯ್ತು. ಹಲೋ, ಮೀಟಿಂಗ್ ಎಕ್ಸಿಟ್ ಆಯ್ತು. ಇಲ್ಲ ಅದೇ ನೀವು ಮೀಟಿಂಗ್ ಲೀವ್ ಆಯ್ತು. Hello. Hello.
Yes,
Am
yes,
I audible?
audible, sir. Audible,
Okay.
sir.
Shall I start?
Yes, sir.
Okay. Om Shri Guru Namaha. The respected principal of Terdal Ayurveda College, Dr. Savita, and all the delegates. Sorry for the delay in logging in. Ragadi Rogan Satatan Shaktan, Aseshakaya Prasatan Aseshan, Outsukya Moha Ratidan Svagana, Yopurva Vaidyaya Namostu Tasmi. With great salutes to all Acharyas of Ayurveda and my dear postgraduates, delegates and friends. Today let us talk few concepts on spinal disorders in Ayurveda. We know that there are a lot of issues to discuss in spinal disorders. But I will make a few explanations which are for thinking purpose of our postgraduates. Practically speaking, Avabahuka and Vridrasi, Katigraha make us to think about spinal disorders in Ayurveda. Kati Prishta Shirograha is one of the best way of understanding spinal disorders in Ayurveda. But leaving a direct explanation of Griva Graha, Griva Hundanam, cervical spondylosis, lumbar spondylosis, we will think about some vertebral column understanding basically in a neurological perspective, and later on I want to have some discussions on away from regular track so that the new era in thinking spinal disorders can be tried. Central nervous system is made up of brain and spinal cord. Brain and spinal cord together are called central nervous system. Whereas in spinal cord, cervical, thoracic, lumbar, sacral and coccygeal segments are there. So in 33 vertebrates, 31 pair of nerve roots coming out. There are 23 main discs which are affected, contained in epidural space, that is network of sensory and motor nerves. A firm cord-like structure is spinal cord. Conus medullaris, phylum terminale, cauda equina. At cauda equina, it will be just like horse tail. From there, nerve fibers enter to the lower limbs. The sagittal plane curvatures of spinal cords are like this. Cervical lordosis should be at 20 to 40 degree, whereas thoracic kyphosis should be 20 to 40 degree. Lumbar lordosis should be 30 degree to 50 degree, and sacral kyphosis continues thereon. The how spinal column looks like is in the sagittal lateral view, it is like this. It is a just like a serpent, it is looking like, whereas in the posterior view, it is a direct straight column. The posterior aspect should be perfectly straight with no lateral curvatures, whereas sagittal view should show inward curvature, lordosis at cervical and lumbar levels, outward, that is kyphosis at thoracic level. The cervical spines consist of 7 vertebrae and 8 nerves, give 2 plexus. One is cervical plexus and another is brachial plexus. Cervical plexus compression causes avabahuka like lakshanas. Brachial plexus compression also causes avabahuka like lakshanas. Vishwachi and avabahuka like lakshanas are presented whenever these plexus get disorder. Brachial neuropathy is a common presentation in market where automobile activities, manual muscular people who are working will get the issues. Functions of the spine in total are: one is maintaining the posture, spinal cord encasement, weight transmission from head to the trunk, posture management, vital organs, back support. See, vertebral column is one of the back support for all vital organs in the body, and muscles attachment takes place to the spine. So if you understand some of the nerve cells connected to central nervous system and spinal cord, or the neurons are basic cells of nervous system. They connect with one another to send and receive messages in brain and spinal cord. So many neurons working together are responsible for every decision made, every emotion or sensation felt, and even every action taken. So whenever there is a problem in 100 billion neurons in the brain and spinal cord, or 10,000 different subtypes of neurons specialized to send, receive, attain types of information, So information changes are due to these 10,000 different subtypes of neurons. Neuron is made up of a cell body with houses and nucleus. Axon and dendrites form extensions from the cell body. If there is a nucleus disorder or axon and dendrite disorder, then the disease starts. Primary support of cells of brain and spinal cord make the secrete proteins called neurotropic factors. So whenever in spinal cord diseases we are working, these are the kaphajanya lakshanas. Neutrophilic factors are secreted proteins, and these protein disorders will cause the spinal cord degenerative disease or avaranajana vikaras. Breakdown and remove proteins or chemicals that might harmful to the neurons. For example, glutamate, a neurotransmitter that in excess causes cells to become overexcited and die by a process called a excitotoxicity. So this is a dhatu gata vikara, where one of the avarana or sanga by glutamate, a neurotransmitter, can cause spinal cord disorders. After injury, divide and make new cells that surround in the site, forming a glial scar. This glial scar is a barrier to regeneration of axon. So this is once again dhatukshayajanya, anulomana dhatukshayajanya vikara in spinal cord. If you want to clear the degenerative disease in spinal cord, I want to put stress on glial scars. If you are able to remove glial scar by either Shodhana, Shamana, Rasayana or Bahiparimarjana Chikitsas, then spinal cord diseases can be treated. Microglia are immune cells of the brain and spinal cord. After injury, these migrate to the site of the injury to help clear away dead and dying cells. They can also produce small molecules called cytokines that trigger cells of the immune system to respond to the injury site. Whenever there is a spinal cord injuries, cytokine storming takes place just like that of cytokine storm in the coronavirus. This cleanup process is likely to play an important role in recovery of function of following spinal injury. So commonly after an accident, abhigata, there is spinal cord injury. In that cytokine storm is there. Due to the pro-inflammatory cytokines, there is inflammation in the spinal cord, and that inflammation will cause again dhatukshaya or margavarana janya vata vyadhis due to the microglia. Oligodendrocytes are glial cells that produce fatty substances called myelin, which wraps around the axons in the layers. Axon fibers insulated by myelin can carry electrical messages, also called action potentials, at a speed of 100 meters per second, while fibers without myelin can only carry messages at a speed of 1 meter per second. So this is gati of vata dosha. If vata gati is to be proper, then oligodendrocyte should give proper myelin wrapping. If myelin wrapping is damaged, then we get degenerative disease of myelin sheath. Then we have to treat oligodendrocytes stabilizing activity by dhatu purana, brahmana, balya and rasayana and medha rasayana drugs like shilajatu rasayana, which will take care of these oligodendrocyte induced myelin sheath damages. So demyelination disorders are big group of disorders in spinal column. They can be treated by Prushta Basti, Kati Basti, Griva Basti, or even Kati and Prushta Pichu, followed by Navananasya, Shiro Basti, followed by Major Basti. Sthiradi Basti or Mustadi Rajapana Basti will be helpful in making these diseases corrected. Gamma aminobutyric acid, the most abundant inhibitory neurotransmitter in the spinal cord. Due to the defect in gamma, many of the spinal cord diseases are noticed. Glia are also called neuroglia, nerve helper cells. These provide structural support, nourishment, and protection for neurons. If anything happens to these glial cells, there will be glial cell tumors, or there is a neuroglial cell tumors. The spinal cord tumor starts. Members of the glia family are oligodendrocytes, or astroglia, astrocytes, ependymal cells, or microglia cells. These cells will cause neurological tumors. Glia from scar tissue at the site of spinal cord injury poses both a physical and because produce severe type of growth inhibiting molecules, a chemical barrier for regenerating axons. So the chemical barrier for regenerating axon should be targeted. This is one of the Visha Lakshana. For that, we have to do Shodhana followed by Rasayana Chikitsa. And in Rasayana, mainly Bala Guduchadi or Bala Rasayana, Ashwagandhadi Rasayanas, they will be helpful. Whereas in Rajata Bhasma is one of the potent nanoparticle or nanotechnological drug in Ayurveda, which will develop these nerve helper cells of neuroglia. Gliosis is process of scar formation after spinal cord injury. Gliosis clears dead tissues and walls of the damaged region to prevent aberrant nerve cell activity, but it also inhibits the survival of neighboring cells. So, this is one of the avaranajanya vatavyadi lakshana due to the gliosis. The resultant scar poses both physical and chemical barrier to nerve cell regeneration. Then we have to clear these scar cells nearing the affected spinal cord injury. Then we are able to give glial cell rejuvenation effect. Non-viable nerve tissue composed of glial cells that form a barrier to nerve regrowth after spinal cord trauma has occurred. So in the glial scar, what we should do is Shodhana followed by Rasayana Chikitsa, like either Rajata Bhasma Rasayana, or we can also think about Abraka, Sahasraputi Abraka Bhasma Rasayanas will be helpful in regenerating these glial scars. Glutamate is a neurotransmitter in the brain and spinal cord that excites neurons. It is an amino acid also called glutamic acid. If this metabolism is hampered, then Majja Dhatvagni Vardhana Chikitsa should be given. The best drugs are like Mahasneham. Whenever there is a amino acid, glutamic acid damage, then we should give Mahasneham. In Kevalam Nirupastambam Adosnehi Rupachare, this line of treatment should be used to treat these glutamate disorders of metabolism. Then we are able to regenerate the spinal cord neurons so that spinal cord injury or degenerative diseases will be treated. Part of the spinal cord and brain consisting of mainly cells and bodies of dendrites and few myelinated axons. This is called gray matter. The brain is the center of our thoughts, the interpreter of our external environment, and the origin of control over our body movement. Like a central computer, it interprets information from our eyes, ear, nose, taste, skin, as well as from the integral organs such as internal organs such as stomach. So whenever brain and spinal cord are unable to process these network activities, then once again spinal cord disorder starts. CPG is central pattern generator. The network of spinal neurons that when stimulated by neurotransmitters cause muscles of the legs to move in rhythmic stepping movements. In this case, this is Gati Vruddhijanya Vatavyadi due to the spinal cord highway damage, that is communication between body and the brain is damaged by spinal cord diseases. When the spinal cord is injured, the exchange of information between spine and other parts of the body is disrupted. So the central nervous system does many jobs at the same time. It controls all voluntary movements such as speech and walking, and involuntary movements such as blinking and breathing. It is also the core of thoughts, perception, and emotions. So whenever we diagnose central nervous system disorders related to these activities, then we should treat spinal column. Voluntary and involuntary movements, over 1 million of axons travel through the spinal cord, including longest axons in the central nervous system. Neurons in the motor cortex and region of the brain that controls voluntary movement send their axons through corticospinal tract to connect with motor neurons on the spinal cord. The spinal motor neurons protect our cord to correct muscles via the ventral root. These connections and control conscious movements such as writing and running are affected by spinal cord axon damages. Then information also flows in the opposite direction, resulting in involuntary movement. Sensory neurons provide feedback to the brain via dorsal root. Some of this sensory information is conveyed directly to the lower motor neurons before it reaches the brain, resulting in involuntary or reflex movement. The remaining sensory information travels back to the cortex. So these cortex and spinal cord movements are once again Vatasya Gati Janya Vikaras and Vagati Gandhanayo Vataha. Many of the informations are not transported by spinal cord. So the information pathways like specialized neurons carry messages from skin, muscles, joints, and internal organs to the spinal cord about pain, temperature, touch, vibration, and proprioception. These messages are then relayed to the brain along one of the two pathways, that is spinothalamic tract or lemniscal pathway. In Pakshagata cases, we come across these issues. The spinal cord is unable to transmit the central nervous system's information to the musculoskeletal controlling pathways. Then we get these disorders, that is pathways are in different locations in spinal cord. So an injury might not affect them in the same way or in the same degree. So depending upon the degree of the damage or the affection of the damage, we have to think about spinal cord regeneration. Paralysis occurs when communication between brain and spinal cord fails. So what we should think is Pakshagate Virechanam is there. That Virechanam should not be simply allocated to spinal cord blood vessels block or atherosclerosis of middle cerebral artery, anterior cerebral artery, or posterior cerebral artery, or internal carotid artery. We should also think about paralysis cases, hemiplegia are treated with Pakshagate Virechanam. Then there is a defect in communication between brain and spinal cord. So this can result from injury to neurons in the brain, that is a stroke, or in spinal cord. So we should find out whether brain is having a stroke or spinal cord is having a stroke. So new concept we are able to divide, that is brain stroke and spinal cord stroke. So when brain stroke is there, we should do CT imaging of the brain or MRI of the brain. When there is a spinal cord stroke, we should do MRI of the spinal cord. Trauma to the spinal cord affects only the areas below the level of injury. However, poliomyelitis, a viral infection, that is amyotrophic lateral sclerosis or ALS, can affect neurons in the entire spinal cord. So we see yearly 1 or 2 cases of amyotrophic lateral sclerosis in our hospital. So poliomyelitis is very common disorder of the spinal cord. Whenever you are getting poliomyelitis, think about lower motor neuron and poliomyelitis induced spinal cord degenerative changes. Then we can set right the spinal cord massage or spinal cord prustavastis or even mustadi apanavastis or baladi stiradi apanavastis will help in this regard. Spinal cord and muscles. This is a relation between snayu and mamsa. Spinal cord is divided into 5 sections, that is cervical, thoracic, lumbar, sacral, and coccygeal regions. The level of injury determines the extent of paralysis and or loss of sensation. So, spinal cord and internal organs. In addition to the control of voluntary movement, the central nervous system contains sympathetic and parasympathetic pathways that control the fight and flight response to danger and regulation of bodily functions. These include hormone release, movement of food through the stomach and intestines, and the sensations from the muscular control to all internal organs. In some of the cases of spinal cord tumors, we are able to notice that prano anna pravesha krit, the anna pravesha karma is damaged in the esophagus due to the spinal cord tumors. So whenever there is the C5 level cord injury is there, the respiratory system will be failure. In such cases, rather than treating the respiratory rasayanas or rather than treating with the anna pravesha, esophageal gastrointestinal rasayanas, we should think about giving spinal cord rasayanas and spinal cord avarana rasayanas like Lashuna Gugulu, Lashuna Prayogam, Lashuna Navanita Prayogam, or Vacha Rasayana Prayogam, or Jyotishmati Rasayana Prayogam, or even Abraka Rasayana Prayogam. From Kotakal Ayurveda pharmacy, Abraka capsules are available. That is Abraka Rasayana Prayogam. These sort of rasayanas should be used, or even Tamra Rasayanas, Tamra Sinduram, Tamra Garbha Potali, or Tamra Basmam. Even I use in practice Arogyavartini Vati in spinal cord diseases to correct these spinal cord and internal organ damages or spinal cord and musculoskeletal coordination damages. Whenever there is spinal cord and muscle damage, Tamra Basma Kalpas like Arogyavartini, Shilajitu Gugulu will help. And whenever spinal cord and internal organ rasayanas are having a problem, Lashuna Rasayanam or even Lashuna Barbaradi Kashayam, Maharasnadi Kashayam, Rasna Gugulu Kashayam, or Rasna Mahayogaraj Gugulu Kashayam, that yogas are helpful. Set of the biological events following spinal cord injuries are cells from immune system migrate to the injury site, causing additional damage to some neurons and death to the others that survived in the initial trauma. So in this case, Abhigata Janya Rana on the spinal cord is to be treated. For that, once again, Bahya Lepa Karmas followed by Raktamokshana in the in and around the site of the damage should be tried. That of oligodendrocytes causes axon to lose their myelination. Then this will be called demyelinating neurological disorders. Neurological disorders, Abraka Rasayana or Abragarbha Potali Rasayana, Swarna Basma Prayogas, or even Rajata Basma Prayogas are found effective. And syrinx is one of the common problem of the spinal cord. Within the several weeks of initial injury, the area of tissue damages has been cleared away by microglia and a fluid-filled cavity surrounded by a glial scar is left behind. Molecules that inhibit regrowth of severed axons are now expressed at this site. The cavitation is called syrinx, which acts as a barrier to the reconnection of the two sides of the damaged spinal cord. This is once again a cyst formation, and this is Margavarana Vatavyadi. Here, the Rukshana, Apatarpana Basti should be tried, Gomutra Siddha Basti should be tried, or Tikshna Basti should be tried. Later on, Lepas from the external and internally, once again, Tamragarbha Potali and Abragarbha Potali like drugs are effective. Whenever we are getting diseases of spinal cord, amyotrophic lateral sclerosis is one common disorder involving the loss of use of muscles. The Mamsa Shosha takes place, but it is not due to the primary Mamsa dosha, it is due to the spinal cord damage. This is Snayu Gata Vata leading to Mamsa Kshaya and Mamsa Shosha. This is Snayu Gata Vata as well as Mamsa Vrita Vata Lakshanas. The nerves controlling these muscles are destroyed, also known as low Gehrig disease. In this ASIA score, measure of fusion after spinal cord injury is done. A means complete injury and E means complete recovery. Ataxia is one of the important aspects of incurable neurological diseases in modern medicine. Problem of muscle coordination due not to the weakness, rigidity, spasticity or sensory loss, but to uncoordinated movement. See, this uncoordinated movement is going to cause ataxia. Coordinated movement is normal vata karma. Uncoordinated movement is due to ataxia. So autonomic dysreflexia, potential fatal complication of spinal cord injuries that involves episodes of extreme hypertension and sometimes leads to intracranial hemorrhage or stroke. It occurs in 90% of the people with cervical or high thoracic cord injuries. So Brown-Sequard syndrome, incomplete spinal cord injury wherein half of the cord has been damaged. There is spastic paralysis on the same side as the lesion and the loss of sensation on the opposite side of the lesion. See, this is Ardhanarishwaravat Pakshagata, ipsilateral hemiplegia and contralateral sensory loss. This is Brown-Sequard syndrome. Very careful diagnosis is required. In this, once again, Dhatukshayajanya Vatavyadi is there. In such cases, once again, Abragarbha Potali or Hemagarbha Potali or even Swarna Basma, Swarna Mahayogaraj Gugulu, such kalpas are found effective. Corticospinal tract, this is nerve circuit pathway that originates in the brain's cerebral cortex and extends to lower levels of the cord, where descending axons send electrical impulses to the spinal motor neurons that in turn control the muscles. In this corticospinal tract lesions, we have to think about a regulation of vata dosha where vata kshaya is there after the avarana. We should understand when avarana takes place, before the avarana there is vata vruddhi, after the avarana there is vata kshaya. This is Ekadeshe Vruddhi and Annadeshe Kshaya. In such cases, Margavarana drugs like Lashuna Kalpas, Shilajatu Kalpas, Jyotishmati Kalpas, and even Maharasnadi Kashaya with Yogaraj Gugulu, such Kalpas are effective. Interleukin 10 is a naturally occurring potent anti-inflammatory nerve cell protector. Intervention stages: when limiting initial degeneration, treating inflammation, stimulating axonal growth, protecting new growth through substrate or guidance molecules, blocking molecules that inhibit regeneration, supplying new cells to replace lost ones, building bridges to plan the lesion activity. These are all the interventions which are done in spinal cord injuries. Here, Shotaharam, Avaranagnam, Vatasya Chalaguna Vardakam, and there is Vatasya Vagati Gandanayo, Gati promoting Chikitsa are to be done. For all of them, Sukshma nanoparticles are to be tried, and Sukshma nanoparticles are from Bhasmas or Rasaushadis, where we can use even Hiraka Bhasma and Rasasindura combination is effective in making all these Shota Pradhana degenerative diseases in spinal cord. We have another condition contributed by me. It is called Meru Gata Vata. The entire spinal cord is damaged in many of the diseases, like in rheumatology, ankylosing spondylosis, wherein HLA-B27 is positive. I have a case of HLA-B27 positive symptomatically. He was treated 8 years before with Shodhana Bastis, Rukshana Bastis, and we are giving annually 2 Bastis. And from this, since 8 years, HLA-B27 is suppressed. The patient of Meru Gata Vata, complete ankylosing spondylitis is under control and he is having asymptomatic stage now. Still, we are giving annually 2 courses of Basti. For him, what we decided is, this is Thamba Sankocha Shota Pradhana Vatavyadi. Meru is Vatasthana. Vatasthane Vatakshaya Lakshanas. So for that, we started giving Eranda Muladi Niruva Basti with Gomutra, and we were started giving Broth Saindavadi Taila Anuvasana Basti in one course, and Hingu Triguna Taila Basti Anuvasana Basti in another course. So in 1 year, one course is given with Hingu Triguna Taila Anuvasana and Eranda Muladi Niruva. In another 6 months course, we have given Broth Saindavadi Taila Anuvasana Basti and Eranda Muladi Niruva Basti. In this way, Merugata Vata can be treated. All cervical, thoracic, and lumbar sacral vertebral bones are affected in rheumatological disease. And in this is Merugata Vata, where all spinal nerve roots of the all areas are covered. CSLS syndrome is contributed by me. It is one of the disease where you can see in the picture cervical spondylosis with lumbar spondylosis. In our OPD, we get a prominent number of patients suffering with cervical spondylosis with or without radiculopathy. A lumbar spondylosis with or without radiculopathy. Cervical spondylosis is Griva Graha, Griva Hundanam, Manyastambam. But with radiculopathy, it is a case of Avabahukam differential diagnosis or Vishwach. Lumbar spondylosis is Katigraha, Trikagraha, Katiprushta Shirograha, or sometimes it is having another pathology called Rudrasi. I have seen some of the cases where Avabahuka and Rudrasi come together, or you can see Vishwasi and Rudrasi come together. Once we treat Avabahukam, patient is improved and we discharge him out. After 6 months or 1 year or 2 years, patient comes with Grudrasi. Sometimes we treat Grudrasi cases and discharge. After 1 to 2 years, patient develops cervical spondylosis and come to us. So I have noticed a Padartha Vijnana's concept, you can remember very well, Vyapti, where Yatra Yatra Dhumaha Tatra Tatra Vani. The same thing can be taken as one of the Vyapti Lakshana here. Yatra yatra cervical spondylosis and radiculopathy, tatra tatra lumbar spondylosis and radiculopathy. So this sort of Vyapti Lakshanas we can understand. This cervical spondylosis and lumbar spondylosis come together in the same patient in some of the certain group of patients, where sometimes patients suffer with only cervical spondylosis, only lumbar spondylosis, sometimes combined cervical and lumbar spondylosis together. These cases are also to be taken as Trikagraham. Trika is cervical sandhi or Trika is lumbar joints. So both are Trika. Trikagrahi Sannipata Jwara and Amavata will have Trika Sandhi involvement. Even in breaking bone type of fever, where Dandaka Sannipata Jwara is there, in that case also cervical spondylosis, lumbar spondylosis come together. In case of some of the diseases, patients suffering with chikungunya, post CG syndrome is one of my diagnoses. Post chikungunya syndrome, in that also patient come with cervical spondylosis and lumbar spondylosis together. In all these cases, rheumatology is one of the scope of understanding the diseases of spinal cord and spine. In this, either spinal cord diseases are there or sometimes spinal column diseases are there. Spinal cord disease is nervous tissue disease. Spinal column disease is vertebral bone diseases. Facetal joints, intervertebral disc damages, and disc damage induced compression leading to the nerval root compression disorders. So these are all coming in Merugata Vata and CSLS syndrome. We should understand in vertebral column disorders, there are 2-3 important points to remember. One is disc prolapse, disc herniation, disc desiccation, and disc bulge. There are 4 sampraptis I diagnose in my patients. You should be also very well versed in MRI scan and CT scan patients will bring to you. So lumbar disc desiccation is there is a desiccated damage. The horizontal or vertical cuts are there in this. This is one of the kshata leading to the lumbar pain. Sometimes disc bulge is there. Disc bulge is disc vruddhi. Disc is fibrocartilaginous tissue where the disc is bulged out. This is one of the disease wherein the vruddhi is one of the lakshana. It is also due to vata prakopa. Disc desiccation is also due to vata prakopa. Disc bulge is also due to vata prakopa. Next case comes is disc herniation. Bulge is the first stage and herniation is second stage. See, just like Bradna and hernia, there is a disc is going to and then what we have to think is we have to understand the disc herniation, where it is protrusion is more. Disc protrusion, disc bulge, disc herniation, and next step is disc is going to cause one of the important damage called disc degeneration disorders. Disc dehydration is another diagnosis. Disc dehydration is a presentation where we come across some of the patients who are suffering with disc dehydration. This is intervertebral disc apmahabhuta kshayajanya vikara. Actually, the discs are made up of Vata Kapha, Prithvi Mahabhuta and Jala Mahabhuta. If Jala Mahabhuta is degenerated, then disc dehydration takes place. Then the disc dehydration is treated with disc rehydration phenomena. Disc rehydration is done by Basti Chikitsa, Kati Basti, Prushta Basti or Griva Basti, Lepas or Tarpana Chikitsas, Brahmana Chikitsas are to be done. In this way, we have to understand some of the vertebral column diseases are also going to cause nerve root compression. Nerve root compression due to facetal hypertrophy or facetal arthrosis or facetal arthritis, followed by nerve root compression. Then we get Grudrasi and Vishwachi like diseases. I have seen many of the patients coming with Vishwachi and Grudrasi together. So as an Aktaika Upakrama, I do Agnikarma, followed by Snehana, Brahmana, Basti, Vatanulomana, or Lepa Chikitsa, Bahi Parimarjana Chikitsas, and later on Rasayana Chikitsas. Bala Rasayana is ultimate. Avartita Kshira Bala Taila 1 in Niramavastha, and Bala Rasnadi Kashayam, Bala Dashamuladi Kashayam, Rasna Shigru Punarnavadi Kashayam, Gugulu Tiktakam Kashayam, Prasaranyadi Kashayam, Rasna Irandadi Kashayam, Ashtavargam Kashayam. These are all to be given in Samavastha of these vertebral column diseases. I have seen in many of the cases when you give Kamaduga Rasa with Moti Yukt, you can find out a degenerative disease of spinal column will be dissolved. And spine regeneration takes place by Kamaduga Rasa with Moti Yukta and Swarna Brodvata Chintamani. And also I have seen Abragarbha Potali followed with some of the kalpas like Swarna Mahayogaraja Guggulu regenerates, the compression of the nerve cord is released, and even Ashtavarga Kashayam with Swarna Mahayogaraja Guggulu, decompression takes place and nerve fiber starts regenerating. So you can see JK syndrome is one more syndrome contributed by me. What it is Janushula Katishula syndrome. This is one of the spinal cord related diseases. Anthropology says that at every 10 years, after 20 years of age, every human being starts getting vertebral column height declines. See, the vertebral column height normally declines by 0.1 millimeter in 10 years of time. So by the time of 40-50 years, patient starts getting spinal degenerative disease, in which we are able to see that the height between two vertebral column, two vertebral bodies is compressing. This is called the nerve degeneration disease due to the spinal muscles, spinal ligaments, and spinal facetal jointal degeneration disorder. So in that, what happens is the vertebral column height when declines in the lumbar spine, then there will be hip joint space declines. When hip joint space declines, then definitely there is cartilaginous space in the knee joint will be declining. So this is Akasha Mahabhuta Kshaya in the joint spaces. I diagnosed JK syndrome, which I have presented the paper, and also some of the seminars I have presented in Jignasa International Conference, where Professor Dr. Nambudiri sir was chairing the session. He convinced about this syndrome. When there is Katishula, definitely patient gets Janushula. It is not due to osteoarthritis. It is definitely Vatavyadi, but it is due to vertebral column height decline in the lumbar spine. Then the decline in the space in the lumbar spine is also going to cause decline in the space in the knee joint space. Then what we get is, you ask some of the patient who comes to your OPD, when they tell knee joint pain is there, you ask, do you have Katishula? Patient says yes. When patient says he is having Katishula and comes to OPD, you ask the question, do you have knee joint pain? Definitely some category of people say yes. I have seen some of the people come with only Katishula, some of the people only come with Janushula, and some of the cases come with Janushula, Katishula together. So this is a syndrome contributed by me. More than 2,000 cases documentation is there, where X-ray of the lumbar spine shows that there is a space decline in the lumbar spine. At the same time, there is a decline in the space in the knee joint. Then what we see is when space is declined in the lumbar space and as well as knee joint space, this disease is called Janushula Katishula syndrome. Yatra yatra Janushulaha tatra tutra Katishulaha. It is Sahajaryo Niyamaha Vyapti. Actually, I see that the Padartha Vijnana is not non-clinical now. If you are able to give this example to the students of first year BMS, they will definitely respect Ayurvedic system, where we can see that spinal cord disease is going to cause the knee joint disease. This is anthropologically connected, the disease of spinal cord and the musculoskeletal joint system like knee joint diseases. I have also seen the cervical spondylosis, lumbar spondylosis with knee joint pain. This is CSLS-JK syndrome. When I do this diagnosis, if a patient comes with knee joint disease, give Janubasti. If patient is improved, it is well and good. Otherwise, take a knee joint X-ray. If knee joint space is reduced, take lumbar spine X-ray. Lumbar spine joint space is also decreased. Then take cervical spine X-ray. Then cervical spine space is also decreased. Then what is treatment required is you should increase the 0.1 millimeter decrease in the height of the spinal column should be increased. This is a mechanical increasing of the space between the two vertebral bodies. And for this, there is no science in modern medical system. They will do MRI spine and they tell that there is a spinal column space is decreased. What surgery they will do? Herniation is there means they do partial hemilaminectomy or some of the herniorectomy. Whereas they cannot increase the vertebral column height. Whereas Ayurvedic treatment like Shodhana, Urdhvada Shodhana if required, or Virechanam, followed by Basti, Rasayana Basti. Firstly, Erandamuladi Kshara Basti I give, then I give Kshira Basti. See, Kshara Basti, Kshira Basti, when we give alternatively, Sama and Nirama doshas are well treated. So I give Manjishtadi Kshara Basti once, and in another Niruva Basti will be Kshira Basti. Sagruta Kshira Basti, that is Sagruta Tikta Kshira Basti, that is Eshtimadu Kshira Sadhita Basti with Eshtimadu Grita. So we give in our Niruva Basti, one Anuvasana is given, one Erandamuladi Kshara Basti is given, or Manjishtadi Kshara Basti we give, one Anuvasana we give. Next Basti will be the Yapana Basti, that is Eshtimadu Kshira Sadhita Sagrita Kshira Basti. Then we give one Anuvasana, and then we give again one Niruha with Manjishtadi Kshara Basti. So Kshara Kshira Avartita Basti when we give, or Kshara Kshira alternate bastis when we give, we are able to increase the spinal column nutrition, spinal column dehydration, and spinal column vertebral length can be increased. Apabahuka is one of the definite spinal column disease. Vitiated Vata dosha located at Amsamula, root of the shoulders, causes Sira Sankocha, constriction of the vascular structure. Sira Sankocha is differential diagnosis with Siragata Vata, Astimajjagata Vata, and then produce Apabahuka, which results in Bahu Praspandita Haram. Patient is unable to do adduction and abduction and circumrotation like movements of the arm is blocked. Acharya Sushruta says, aggravated Vata dosha localized in the Amsa Desha dries up the binding ligaments. See, this is Snayu Vishoshana. Tam Sira Snayur Vishoshacha is Pakshagata Lakshana. If patient is having, we have seen some of the cases, even common people will talk like this. Whenever cervical spondylosis with radicalopathy comes, patients are afraid that in future I may get paralysis. Definitely where Snayu Vishoshana Janna Pakshagata, patient is unable to lift the upper limb takes place, result in constriction of Siras and then finally leading into Apabahuka. Here we have to diagnose Apabahuka individually or Charakokta Ardita Lakshanam. In Charakokta Ardita Lakshanam, I diagnose Charakokta Ardita as one half of the face is involved, one upper limb is damaged. Monoplasia of upper limb or lower limb with one half of the face involvement is facial weakness. In Davidson textbook previous 2 editions back, he has written facial weakness, where in facial weakness, one half of the face is involved and one upper limb or one lower limb is involved. This is Charakokta Ardita Lakshanas. And their spinal cord lesion is one of the common cause. According to Madhavanidhana, Vayu localized in the shoulder region causes atrophy of the structures binding the shoulder joint. And when the same atrophy around the shoulder joint is produced by vitiated Vata leading to contractures of surrounding ligaments, the condition is called also Avabahuka. Apabahuka and Avabahuka, both word meaning is same, and but in authors have used two terminologies. In clinical features of apabahuka, sthanika vikara is there, bahu praspandita haram is there, and difficulty in movement or impairment, loss of movement of one upper limb is there. This is karma kshayam is there, amsa sandhi shulam. This is periarticular joint pain is there, stamba is there, mamsa shosha is there. Mamsa shosha is due to avarana, stamba is due to avarana, sandhi shula is due to vata vriddhi, karma hani is due to siragata vata and snahigata vata, and apabahuka samprapti or vishwachi is one of the differential diagnoses is there. Then talam pratyangulinam prati is vishwachi, bahu praspandita haram is avabahuka. In modern perspective, adhesive capsulitis or frozen shoulder, rotator cuff tendinitis, and impingement syndrome. When the capsule is having impingement on one another, it is once again Margavarana Janya Vata Vyadhi in rheumatology, cervical spondylosis, bicipital tendinitis is Shota Janya Vata Vyadhi, osteoarthritis of shoulder joint. So in trapezius and splenius capitis, where you can see the muscles are having spasm. Mamsa sankocha is one of the lakshana, where Mamsa sankocha is Vataja Samanya lakshana in Charaka Samhita Chikitsa Zana 28th chapter, where Sankochaha Parvanam Stamba is there. It is one of the Vatavyadi lakshana, and spinal cord is surrounded by spinal fluid. This is kapha. Tarpaka kapha in brain, Tarpaka kapha in also spinal cord. By several layers of protective structures like durameter, it is the strongest outmost layer. Spinal cord and nerve structures you can see like this. And anatomy of compression. Anterior compression causes IVDP or osteophytes are compressing. Anterolateral compression is due to the joints of Lashka. Lateral compression is due to facetal joint. Posterior compression is due to ligamentum flavum. See, we should understand these four categories of compression of the vertebral column disorders. Ligamentum flavum thickening is also one of the common cause for the backbone pain, or kati shulam trikagraham. Sometimes we come across osteophytes, that is malarupi asti vruddhis, and sometimes facetal joint arthritis. So neck pain is caused by muscle strain, ligamental sprains, arthritis, and pinched nerves. Neck pain, 10 patients of adults have neck pain at any one time of their life. So neck pain is common cervical complaint, and majority of, regardless of the cause, they recover. In the middle age, I have seen it is Paramavada, where gradually cervical spondylosis comes and gradually it will decline on its own, self-limiting. But sometimes after 2 or 3 episodic disease, it will become a permanent cervical spondylosis. Abnormal wear and tear of soft tissues. This is Dhatukshaya as well as Margavarana of the disc and vertebrae. And gradual narrowing of the disc space. This is once again Dhatukshaya Janya Margavarana. Loss of normal square shape of the bone, growth of the edges of the bone, bone spurs. This is Malarupi Asti Vruddhi. Bone spurs increases, so increase pressure on the surrounding tissue and cause 90% of pinched nerves. Symptoms like neck pain, weakness, numbness or arms on the shoulders, headache and limited neck mobility is there. In cervical disc disease, C5, C6 and C6, 7 are common cervical disc disease areas. Constant trauma of the neck. We are doing constant exercises, constant movement, and then pathology is disc bulge or disc protrusion, extrusion, herniation of the nuclear material resulting in anterior extradural mass attached to the nucleus of origin, and disc sequestration, separation of the material from the disc. It is sequestrated. It is now one of the shalya. It is a surgical correction is required. Whether it is a bulge, protrusion, extrusion, we should treat them as Margavarana-janya Vata Vyadhis of spinal cord. Disc sequestration requires a surgical intervention. Pain from joints and ligaments and muscles, pain from the nerve roots or spinal cord should be differentiated. If it is from ligaments and muscles, pain and stiffness is there. If it is due to the cord, it is root pain is seen. If it is due to the ligaments and muscles, deep, dull, aching pain is there. Often it is episodic, whereas in case of cord-related pain, sharp, intense, often burning pain. Sa daharuja, it is pitta samsrishta vata vyadhi. Excessive or unaccustomed activity or sustaining an awkward posture. Because of our awkward posture, ligament and muscle damage starts, or because of radiating trapezial or interscapular areas down to the arm, there will be root disease. Differentiation, we can think also aggravated by the movement is nothing but the muscles and ligaments. If it is symptoms aggravated by neck hyperextension. If you do hyperextension like this, if pain is increased, it is due to the cord involvement. We come across to the Roganidhana perspective of understanding spinal cord diseases. There are various examination methods of the spine. There are innumerable methods of spine examination: inspection, palpation, percussion are three main important prospects. In inspection, look from side. Cervical lordosis is going to give you the clue. Increased lordosis is muscular weakness or imbalance. Then Mamsagata Vata Chikitsa in spinal cord disease is to be given. Lessened lordotic curvature, muscular spasm or guarding and or nerve root impingement is there. Then this lordosis is damaged. Then you should give Agni Karma as Pradhana Chikitsa, Lepa as Pradhana Chikitsa, Dhanyamla Dhara as Pradhana Chikitsa. You can see scoliosis, kyphosis, and increased lumbar lordosis can be seen, or even some of the cases of the vertebral column swelling is also there. Spinal deformities. You can see osteophytes in between two spinal cord lesion. We can see there is a straightening of cervical spine. It is due to the paralumbar muscle spasm. So muscle spasm is Mamsagata Vata, Snayugata Vata, and the bones become, vertebral column becomes straight. Then you should give chikitsa to the Mamsa and Snayu, and then patient will be all right. Osteophytes are seen. These osteophytes will make beaking appearance. So the beaking appearance is one of the common osteophytes in cervical spine. And palpation. On palpation, local rise in temperature and spinous process palpation, prominent spinous process palpation is done. You can feel midline spinous process, paraspinal soft tissues, supraclavicular fossage for cervical ribs and enlarged lymph nodes. The anterior neck structures, including the thyroid, can be seen. Special tests like Sperling test, compression test, distraction test, Valsalva test, swallowing test, Addison test. Range of movement can be checked by active and passive movements. The flexion, ask the patient to bend the head forwards. Chin should be able to touch the chest. Up to 80 degrees, he should bend. This is normal. Extension, ask the patient to look up and backward. Up to 50 degrees, patient should be able to extend. If this is not happening, there is Thamba, Sankocha, and Vatavyadi. Lateral flexion should take place up to 45 degrees, where it should involve atlantoaxial, atlanto-occipital joints. Circumrotation, 80-degree patient should be able to do circumrotation. Patient should be asked to look over his shoulder. Then this is a case of rotation. Restricted and painfully seen in cervical spondylosis. Appley's scratch test. Patient should scratch the scapula, and if he is unable to do from upward or backward, from lowards, it is positive. Arm drop sign. You lift the arm and drop it if patient is feeling pain. Empty cans test. You press the both hands and patient should put pressure upwards. Compression test. Testing for compression of the cervical root or facet joint irritation in the lower cervical spine. Ask the patient to seat the table. Patient head is natural. Therapist stands behind the patient. If radiating pain or other neurological sign in the same side of the nerve, in the nerve root, or pain local to the neck or shoulder is there, by pressing above, then the sign is positive. Sperling test, it is also compression in the extended neck. Swallowing test, patient deglutinates and bony protuberance or bony osteophytes or soft tissue swellings can be seen with hematomas. Valsalva test, ask the patient to hold his breath and bear down as if he were moving his bowels. Then ask whether he feels any increase in the pain and describe the location. This test increase intrathecal pressure. If a space occupying lesion such as herniated disc or tumor present in the cervical canal, patient may develop pain in the cervical spine secondary to increase in the pressure. So L'Hermite sign, it is just like looking like a yoga posture. Patient is stretching his head forward and his two legs upward. And this sign detects protrusion of cervical intervertebral disc or an extradural spinal tumor irritating the spinal durameter. See, such a beautiful bedside examination we are missing in the neurology clinics. People are running behind, modern people are running behind CTs and MRIs. A simple yogic posture like posture can give you patients the intervertebral disc extradural spinal tumor or irritating spinal durameter. Distraction test. When spinal column, you are putting a distraction, lifting upwards. To relieve the pressure on the cervical roots may be used after spurling or compression test. Place open palm in one hand under and patient's chin and other hand upon the occiput and temporalis, then gradually lift and distract. Patient starts getting pain. So Adson test, you lift the hand, pull arm the downwards and palpate the radial pulse and turn the patient's head to the same side or extend the neck, abduct or extend or laterally rotate the shoulder. From this position, the patient take deep breath and hold, feel radial pulse. The fading of the radial pulse indicates positive thoracic outlet obstruction. Radiculopathy, lateral stretch test. When stretching of the neck in the opposite direction will elicit pain along the nerve root distribution. Range of movement test. In the active movement and passive movement as shown in the slide, best done in sitting or best done in laying posture. In the active method, flexion, touch chin to the chest, extension, look straight above head, or lateral flexion approximately 45 degrees, rotation, nose over the tip of the shoulder. With these active movements, patient pain can be elicited. Anvil distraction test. And if you see Samprapti of Apabahuka, the Vatakara Hetus and Kafakara Hetus, either Bahu Praspandita Haram is due to Snayu Kandara, Mamsa Sira Dushti, or Kafavrita Vyana Sandhi Dushti leading to Sira Sankocha and Apabahuka. Either Vataja Lakshanas, Kafaja Lakshanas, or Vata Kafaja Lakshanas. Then Shodhana, Rukshana, Apatarpana, followed by Snehana, Brahmana, Dhatupurana, Rasayana Chikitsa is required. And if you do differential diagnosis with Ekanga Roka, in Ekanga Roka, Hastamva Todasholakrit, in Vishwachi, Bahuho Karmaha Kshayakari. Both Bahus are having this. Amsa Shosha is Daurbalyam in Amsa Sandhi, whereas Apabahukam is Amsa Mula Stito Vayuhu Sira Sankocha Tatragaha, Bahu Praspandita Haram with Shula Stambam. So the tension neck, torticollis, fibromyalgia, myofascial pain syndrome, cervical spondylosis, cervical IVDP, or even infectious tuberculosis, osteomyelitis, epidural abscesses, tumors, myelopathy, cervical stenosis, osteoarthritis, brachial plexus pathologies, thoracic outlet syndrome, and herpes zoster of the neck, inflammatory pathology, rheumatoid arthritis, syringomyelia, transverse myelitis, meningism, or even severe arterial hypertension, vertebral anomalies, myopathies, or even pain from the upper limb, that is lateral epicondylitis, angina pectoris, upper limb disease, or abdominal irritation. Udavarta and Koshtakatavata are also having Prushta Ruja. So if you do differential diagnosis in modern, bursitis is joint tenderness, tendinitis is pain in the shoulder and arm stiffness, rotator cuff injury is pain in the shoulder and muscle weakness, cervical spondylosis is pain in neck and shoulder, weakness in the right upper arm, frozen shoulder is stiffness, pain, limited range of movement. Stiffness, pain, limited range of movements, pain in the shoulder during the movement, and pain is usually worsens at night. Ratri Kale, Vata Kale, Vata Vruddhihi. So Vishwachi is close resemblance with Avabahuka. Pain radiates from upper arm to the forearm and palms, distributed from the back of the neck to the tip of the finger. Contrary to this, in Vishwachi, the pain is more or less restricted to Amsa Pradesh in Apabahuka. Amsa Shosha, a separate entity in Madhavakara, it should be differentiated from Apabahuka. In Amsa Shosha, Mamsa Shosha Lakshanas are there. I have seen case where only deltoid muscle group is absent. So it can be differentiated by the presence of Mamsa Kshaya, Mamsa Shosha in Amsa Pradesha. Pain is not the diagnostic criteria. Ekangavata is weakness of affected upper limb and features of Akarmanyaha and Vichetanata. So investigations for these Apabahuka and all spinal cord diseases is plain X-ray, stress X-ray, CT, MRI, myelography, nerve conduction, nerve root blocks, discography. So Chikitsa Sutra, if you see in one line, Avabahu hitam nasyam, snehascha auttara bhaktikaha, nasya and auttara bhaktika sneha. So food, snehapana and food. In another fashion, snehapana, food and snehapana. It is called auttara bhaktika sneha. Nasya is Griva Skando Urasam Balajananartham. Ruksha Svedam in Samavastha like Valaka Sveda, Churnapinda Sveda, and in Snigdha Sveda, Niramavastha, Jambira Pinda Sveda, Shashtika Shali Pinda Sveda, Arkapatra Pinda Sveda. Neck pain is treated with yoga postures, neck stretching exercises. And in Yoga Ratnakara Vata Vyadhi, Bahu Parivartanam is told as Chikitsa. What is Bahu Parivartana is movements of shoulder joint. This has been mentioned as an effective remedy in Apabahuka by Yoga Ratnakara. It may be correlated with physiotherapy of current science. A best pillow practice. Best pillow practice is use a suitable pillow which is having to maintain the maintenance of curvature of the spinal column. In the Katigraha, it is one of the spinal cord disease. Katishula, Katigraha, Trikagraha, Prishtagraha, Trikashula, Prushtachula, Grudrasi. All these lakshanas are there for lumbar region. Lumbar spine is having again lumbar vertebral space reduction, disc protrusion, disc herniation, disc bulge, disc dehydration, and disc desiccation. 5 pathologies are there in lumbar spine. So you can see normal and degenerative disc movements and bulging of the disc and herniated disc or thinning of the disc. Thinning of the disc is degenerative disease. Patient comes with Katishula. Grudrasi is more than 10 million cases in India. And Spikpurva, Katiprishta, Uru Janu Janga Padam Krama. It is Prustati, Stamba, Ruk, Toda. All these are important lakshanas. Vata Jagrudrasi and Vata Kapha Jagrudrasi are there due to Vata and Vata Kapha dosha. And we can do Vyadhi Vinishya. Vata Jagrudrasi is Stamba Ruja Toda Pradana Vyadhi, whereas Vata Kapha Jagrudri is Stamba, Gaurava, Arochaka, Tandra Yukta Vyadhi. Uru Stamba is Rukin, Uru, Shota, Ases, Ankocha, Angamarda, and Tandra, Aruchi, Taimitya is there. In Khalli, Pada Janga, Uru, Mula Pida. This is Mardanavat Pida is there in Khalli. For Vataja Grudrasi, it is Dhatukshaya leading to Grudrasi Lakshana, or in Vata Kafaja Grudrasi, excessive secretion of Kafa in Sandhisthana. Tarpaka Kafa is in Sandhi. Vata Kafaja Lakshanas will cause Margavarana, and then Vata Kafaja Grudrasi will develop. Sciatica is sciatic nerve inflammation or the paralumbar root compression, or disc damages, or space occupying lesion in the spinal column. Differential diagnosis: rheumatoid arthritis, trauma, and coccyx pain. Even disc herniation, discitis, lumbar compression fracture, lumbar degenerative disc disease, lumbar facet arthropathy, mechanical low back pain, and overuse injury. Roland and Morris have given low back pain disability questionnaire. You can go through that. And Chikitsa Sutra of Katishula, Grudrasi and all is Acharya Shushruta says Siraveda and Grudrasi, Vagbata says Siraveda and Grudrasi, Vangasena says Deepana, Pachana, Mardana, Vashpasveda, Upanaha, Vamana Virechana, Agnikarma, Chakradatta says Pachana, Shodhana, Basti and Shastrakarma, Yoga Ratnakara says Siraveda and Agnikarma, Mahaprakasha, Virechana, Vamana, Basti. These are all the sites of Raktamokshana. One in the femoral triangle, one in the backside of the thigh, one in the backside of the popliteal fossa, one is the inner side below the Indrabasti Marma. So 4 angulas lower than the Medra and Basti are 4 angulas up or low from the Janu Sandhi, and 4 angulas in the Gulfa Sandhi, and in between Kandara and Gulfa according to Charaka in Grudrasi. So Siraveda becomes one of the best line of treatment when there is Siragata Vata Lakshana as well as Snayugata Vata Lakshana as well as Margavarana Janya Grudrasi. So today I have taken much of your time. To summarize, spinal cord diseases can be diagnosed by modern diagnosis, Ayurvedic treatment, and modern assessment. Or the Meru Gata Vata is one of my contribution to understanding of this disease. Meru Gata Vata is a Vata Vyadhi. It is a Anukta Vata Vyadhi. I have contributed for Meru Gata Vata Vyadhi Lakshana, where orthopedic line of rheumatological diagnosis is cervical spondylosis, lumbar spondylosis, and the total vertebral column spondylosis or ankylosing spondylosis, HLA B27 positive. And another condition I was telling, CSLS syndrome, is cervical spondylosis with lumbar spondylosis. Etra etra lumbar spondylosis, tatra tatra cervical spondylosis, etra etra cervical spondylosis, tatra tatra lumbar spondylosis. And we can diagnose in Dandaka Sannipata Jwara, Trikagrahi Sannipata Jwara, and in case of Amavata, Vrishchika Damshika Vedana in Trikasandhi. Trikasandhi may be cervical spine, Trikasandhi may be lumbar spine. So in both cases, we can understand spinal cord disease. Spinal cord abhigata janya vikaras, where cord is completely cut. We don't have a Ayurvedic line of thinking. Modern line of thinking is also not there. If spinal cord traumas are there, partial trauma, partial cut are there, we can think about Bhagna Sandhana Krit. Lashana is a Bhagna Sandhana Krit Dravya. Lashana Rasayana is important Rasayana for spinal cord diseases. In take-home messages, Lashana Kalpas, Prasaranyadi Kashayam, Gandharva Hastadi Kashayam, Rasna Erandadi Kashayam, Shilajatu Gugulu, or Trayodashanga Gugulu. You should not forget, whenever there is a Trikasandhi involvement, cervical spondylosis or lumbar spondylosis, Trayodashanga Gugulu is Agra Aushadhi. And along with that, Gandharva Hastadi Kashayam is Kati Visheshatvam. It should be given in Kati Shula Vishesha. Dhanvantaram Kashayam is Maduram Snigdam Vataharam. In Nirupastambita Vatavyadi, the Dhanvantaram Kashayam should be used. And in case of Grudrasi is Hacharadi Kashayam with Hacharadi Thailam. And in motor neuron diseases, one of the spinal cord disease and amyotropic lateral sclerosis is one more spinal column disease. And in what happens is, in motor neuron disease, upper motor neuron and lower motor neuron both are present. In amyotropic lateral sclerosis, if you see this palmar thinner surface and hypothinner surface emaciation takes place, mamsa kshaya, mamsa shosha takes place, and the lateral border of the tongue becomes tongue fasciculation. By Darshanagamya Bhava, you can diagnose the amyotropic lateral sclerosis and Grudrasi, Apabahuka, or even Griva Hundanam, Trika Prushta Kati Graham, Kati Prushta Shirograham. They are all spinal cord diseases. Even in Ekangavata, Charakokta Ardita, we can see some of the hemiplegia cases are having involvement of corticospinal tracts. When corticospinal tracts are damaged, spinal cord is involved in the management of upper motor neuron leading to Pakshagata. Then also we should think about spinal cord. Whenever we call central nervous system means brain and spinal cord. We should not forget. Sushumna Nadi is present inside the Meru, and Sushumna Nadi, Ida and Pingala Nadi. There are three Pradhana Nadis. Sushumna Nadi is Madhya, Ida is left side, Pingala is right side. Their decussation takes place in the Surya Nadi and the Chandra Nadi. So in the Meru Gatavata and Meru Sirsha Gatavata, it is a yogic technique and tantrika vidya we should understand. Shat chakras are having connection to the spinal cord. Shat chakras understanding and spinal cord is also important. And whenever you get abdominal organ and thoracic organ related diseases, whenever there is a heart disease, you should see that thoracic spine spondylosis and pain is there. Whenever Kati Shula is there, the uterine diseases, bladder diseases are there. So all organs in the body, that is endocrine organs or exocrine organs in the thorax and abdomen, definitely have spinal cord connection. So whenever you get stomach, liver, pancreas, kidneys, or even suprarenal gland disorders, try to manipulate or try to do abhyanga of spinal cord. In 7 postures of massage, one posture is dorsal posture. So this dorsal spinal massage, even to the kids or even to the elder age people or even to the Swastavrita Anuvartana, spinal column massage is a must. So in Abhyangam Acharya Nityam, sa Jara Shrama Vataha, Shira Shravana Padeshu Tam Viseshena Shile. Shira means Shira and Prushta. Shira and spinal cord, Abhyanga must be done. Then Kati, Nabi, and then Pada, in these Abhyanga should be done. Spine is important part of CNS. Meru Danda governs most of the activities of musculoskeletal and splanchnic activities. Management of spine is based on Vatavyadi theories. Snehana, Brahmana, and Rasayana have augmented role to play in care of along with Yoga Chikitsa. And Bahiparimarjana Chikitsas like Abhyanga, Dhanyamladhara, Lepa, Sthanika Tarpana are useful. Meru Gatavata, CSLS syndrome and JK syndrome are new trials and contributed in my 22 years of practice. We should think about Anukta Vatavyadis in spinal cord Chikitsa. With this, I conclude my talk. Sorry for the initial delay, and I am thankful to the organizers, principal, and all the staff members of Terdal Ayurveda College, Dr. Chaya Madam, and all my delegates, students, postgraduate scholars, and all the practitioners. And once again, thank you one and all. I am thankful to my teachers and my patients, and also my beloved principal for allowing me to do this webinar, Dr. Syed Attar Fatima Madam, because with her constant support, we are able to do clinical works as well as research works. I am thankful to the Commissioner of Ayush, Dr. Meenakshi Negi Madam, for encouraging us. Thank you one and all. Thank you once again. Namaste.
Thank you, sir. Thank you for a very informative speech. Usually, we think of Dudasi, Vishwaji, Katigraha. You have thrown more light on spinal disorders. Along with that, you have told treatment modalities also. It's very useful to all the audience. Thank you, sir. There are some questions in chat box. What is the treatment of Apavahuka in diabetic patient?
Yes. If diabetes is under control, Apavahuka can be easily treated. Otherwise, my prescription is Prasaranyadi Kashayam with Mahavata Vidvamsarasam. If patient is not having hypertension crisis, Prasaranyadi Kashayam with Ekanga Veera Rasam. Because the radiating pain should be treated in diabetes with Mahavata Vidvamsarasa or Kamaduga Rasa. And patient should be given with Ashwagandha and Gomutra Lepam on the cervical spine. This Ashwagandha Gomutra Lepam is effective, and in Gada Nigraha, one more drug is there, Ashwagandha and Shunti. Rasayanam should be given. Ashwagandha Shunti as one of the Rasayanam should be given. So Yatkinchit Prameha Haram and Apabahuka Haram. That is Prasaranyadi Kashayam, Mahavata Vidvamsarasam with the Madhumehara drug like Nisha Malakyadi, Nisha Katakadi drug should be given. Or in Charaka Samhita, Daru Surakwadi Kashayam is there. Trifala Surakwa Devadaru, this Kashayam is effective. Thank you.
Thank you, sir. Next question. When CT and MRI interventions should be chosen in spinal cord and brain pathologies?
Actually, if you do clinical examination, I was showing you a few of the neck examination protocols. If you do neck extension stretch test, if patient is having a pain, it is not radiologically, that is X-ray is not enough. If you take X-ray, it will show simple degenerative osteoarthritis, osteophytes, and degenerative changes. If patient is having cord lesion, then patient is having radiculopathy, and patient is not responding well to Grivapasti, Nasya, and some of the Shamana Ushadis, definitely think about MRI scan, where some of the disc herniation, disc desiccation, or cervical canal stenosis, lumbar canal stenosis. When stenosis is there, there will be foot drop. Lumbar canal stenosis cases will come with foot drop. Then there is MRI scan should be done. Whenever there is a neuromuscular weakness and patient is having karma hani, definitely CT and MRI should be done. If there is no karma hani, if there is no cord lesion, if the patient is having only an osteoarthritis like presentation, X-ray is enough. If patient is having inflammatory pathologies, CRP is good line, and if it is rheumatological cases, RA factors, anti-dsDNA, and antimicrosomal antibodies test, and even HLA-B27 for ascending lumbar spondylitis, that is ankylosing spondylitis. If ankylosing spondylitis is there, one MRI must be ruled out to rule out any cord compression. If there is lumbar canal stenosis, foot drop is there, MRI must be done. Or initially do bedside examination and Upashaya, Anupashaya Bhyam Pariksha. If Upashaya is not there for routine Janu Basti, Janu Lepa, Kati Basti, Kati Lepa, Abhyanga, Dhanyamla Dara, if it is not giving you result, then think about going to that. Or whenever Karmakshaya is there, CT MRI must be taken. Whenever trauma history is there and motor function loss is there in spinal column diseases, the karma hani must be checked with CT and MRI. Thank you. Very good question.
Thank you, sir. Next question. How can we understand the Gudagata Vata and Pakvashayagata Vata?
Yes. See, in Gudagata Vata and Pakvashayagata Vata, some of the symptoms are overlapping. It looks like Gudagata Vata, but it will be having Koshtagata Vata. It looks like Koshtagata Vata and Gudagata Vata. There, one simple test I'll tell you is, if you do Vatanulomana Chikitsa, if you give Paniya Ksharas, and Matra Basti, both will respond. Shaddarna Yogam and Paniya Ksharam and Matra Basti, Budagata Vata and Koshtagata Vata or Pakvashaya Gata Vata will be improved. See, in Pakvashaya Gata Vata, the Lakshanas of Bradna is there. That is, inguinal canal intra-pelvic pressure increased Lakshanas are there. That will be Pakvashaya Gata Vata. Intracolonic pressure is raised. That is Pakvashaya Gata Vata. Only the anal canal pressure is raised. That is Budagata Vata. But somehow Katishula is going to happen in all 2-3 cases. Budagata Vata or Pakvashaya Gata Vata. In both cases, Budashula. In both cases, Katishula, Uru Sadam, those Lakshanas are coming. Then Upashaya is Paniyaksharam, Shaddarna Yogam, Matra Basti. Or Gandharva Hastadi, Erendasneya Prayoga will be effective in all 3. So Upashaya, Anupashaya, Abhyam Pariksha. But structurally, scanning will not give you any substantial information. These are all functional diseases.
Thank you, sir. Next question: how brachial neuralgia should understood by Ayurveda?
Yes, neuralgia is a category of diseases where nerve inflammation is there. When nerve fiber inflammation is there, one due to dhatukshaya, another due to nutritional deficiency, third due to the cord compression, or fourth is due to the demyelination. So whenever this neuralgia comes, first give nutritional supplement. Upashaya is there, well and good. If not there, evaluate hyperglycemia and diabetes. If diabetes is there, neuralgia is very common presentation. If these two are ruled out, if patient is having dull ache and paresthesia, Daha is not there, Arthi and Supti is more, then you have to undergo for nerve conduction studies. If you do nerve conduction studies, neuralgias are once again differentiated from axonal blocks. Axonal conductive disorders are ruled out. So neuralgia should be treated with the cobalt line of treatment. See, nowadays modern people are giving cobalt for neuralgias. The methyl cobalamin is derived out of cobalt. Cobalt is a radioactive element used in anti-cancer treatment. But now that anti-cancer drug is given for Pandu and neuralgias. Neuralgia is weakness of the nerve or nutritional deficiency of the nerve or free radicals which are damaging the nerve, and it causes nerve pain. So that nerve pain is dull, continuous, not responded with posture. It aggravates with the improper posture and stretch. Whenever nerve stretch we give, the neuralgia will increase. In such cases, nerve balyam, rasayanam, medium, and nanoparticles, the abraka basma or rajata basma, such compounds must be tried. Even Malla Garbha Potali, Shuddha Malla, we have tried in neuralgia, one clinical trial we have done. Shuddha Malla, 3 milligrams with Maricha Churna 5 to 7 milligrams. If dose is given, neuralgia will respond definitely. Faster than acyclopinac paracetamol or dicloparacetamol, this Shuddha Malla Prayoga, not Malla Basma. Shuddha Malla Prayoga is effective from, it is from Rasatarangini it seems. Shuddha Malla is effective in neuralgia pains, whether it is diabetic neuropathy or nutritional deficiency myopathy or conduction axonal polyneuropathies. Conductive axonal polyneuropathies are diagnosed by nerve conduction studies, a costliest affair. Then if patient done that, then we have to think about Urustambahara yogas, Lashuna Kalpas, Margavarana Haram, Dhatukshayam, Balyam, Brummanam, Vatagnam. This sort of treatment, and Basti is inevitable in these cases.
Thank you, sir. Thank you so much for your very informative speech. Now we are going to start valedictory function. Stay with us, sir. I like to call Dr. Shrikant Vislavas, sir, to host the valedictory function.
Am I seeing Dr. Parameshwarappa Badgi? Namaste. Badgi sir, how are you?
Om Dhanvantare Namaha. Good afternoon to all. Myself Dr. Islava Srikhan, Assistant Professor, Department of Rachana Sharira, Gramina Ayurvedic Medical College, Tirga. Let's start evaluated function. Sri Bahubali Vidyapith's JV Mandals, Gramina Ayurvedic Medical College, Tirga, welcomes you all for the 6th National Webinar on AYURVATA CHINTANA 2020 from Department of Roganidana, Evam Vikruti Vignan. Tena vina tarunam api na chalat. It means without God, even a single grass can't move. Prayer is the most powerful tool mankind has to reach the God. It gives us strength and confidence. So let us begin this function by seeking the blessings of Lord Almighty with prayer. I request our staff and students to grace this occasion with the Dhanvantari prayer.
नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारुग्यभयमृत्युनाशं धातारमीशं विविधौषधीनाम्
ಮಾಧವ್ ಡಿಗಲ್ ಸರ ನಮಸ್ಕಾರ. ಅದು ಅನ್ಮ್ಯೂಟ್ ಇತ್ತು ಆಗ, ಹಂಗಾಗಿ ಸೌಂಡ್ ಬರ್ತಿರ್ಲಿಲ್ಲ.
ನಮಸ್ತೆ ನಮಸ್ತೆ ಸರ್, ಚೆನ್ನಾಗಿದ್ದೀರಾ?
ಆರಾಮಿದ್ರಿ?
ಬಹಳ ದಿನ ಆಯ್ತು ನೋಡಿಲ್ಲ.
ಬಹಳ ದಿನ ಆದ್ಮೇಲೆ ನಿಮ್ಗೆ ಕೇಳ್ದಾಗ ಆಯ್ತ ಸ್ಪೀಚ್ ನೋಡಿದ್ರಂಗ ಆಯ್ತು, ದರ್ಶನ ಆಯ್ತು.
ಬಹಳ ಸಂತೋಷ ಆಯ್ತು, ಬಹಳ ಸಂತೋಷ.
ಖುಷಿ ಆಯ್ತು.
Thank you for the prayer. Now I request Dr. Vinayak Mali sir for welcome speech. Good afternoon and all. Myself Dr. Vinayak Mali, Assistant Professor, Department of Children, Gramina Ayurvedic Medical College, Tirga. I would like to welcome our Honorable Chief Patrons, Sri D.C. Patil sir, Chairman JMC Tirga, and Dr. J.V. Algur sir, Secretary JMC Tirga, and Nilesh J. Desai sir, Treasurer JMC Tirga. I'd like to welcome our today's e-valedictorian of this webinar, and it's my pleasure to extend a warm welcome to Dr. Parmeshwara P.S. Badgi, Associate Professor and HOD, Department of Valedictory, Institute of Medical Science, Banaras Hindu University, Varanasi. Your presence makes us very happy, sir. I would like to welcome our e-inaugurator of this webinar, Dr. Syed Akhtar Fatima ma'am.
Principal Tarnath Government Medical College, Ballari. I would like to welcome our beloved Principal, Professor and HOD, Department of Panchakarma, President of this webinar, Dr. L.N. Brother Sir, James C. Teda. I would like to welcome our Organizing Secretary, Dr. CHINTANA, Associate Professor and HOD, Department of Roganidana, Gramin Medical College, Teda. On behalf of our management, principal and staff, I extend my special welcome to all the guest speakers. Dr. Prasanna N. Moksale Sir, Associate Professor, Department of PG Studies in Roganidana, SM College of Udupi, and Dr. Shalini Rao, Assistant Professor, Department of Roganidana, All India Institute of Ayurveda, New Delhi, and Dr. Veena G. Rao Ma'am, Department of Panchakarma, JSS Ayurveda Medical College, Mysuru, and another speaker, Dr. Madhav Diggai Sir, Professor, Department of PG Studies in Kayachikitsa, Tarnath Government Ayurveda Medical College, Ballari. I would like to welcome our teaching staff, hospital staff, and students of GMC, Teda. I would like to welcome all the media personnel, faculty members, practitioners, UG students, PG scholars of different colleges, and audience from different parts of the country. Welcome one and all. Thank you, sir, for your warm welcome speech. Greenery gives pleasure to human eyes. Now, I request our management team for watering plant. Thank you for watering, sir. It's time for Valedictory speech. Now I request Dr. Kullur Madam to introduce Dr. Parameshwarappa S. Kadgi sir.
Sure.
Good afternoon to all. Myself, Dr. K. Kulur, Department of Dravaguna, Assistant Professor, Gramina Ayurvedic Medical College, Teda. It is my privilege to introduce Dr. Parameshwarappa S. Badgi sir. Sir was born on 1st August in 1992. He has completed post-graduation in Roga Vijnana and Vikruti Vijnana, subject from University of Kolkata. He has completed PhD in Kazakistan from Banaras Hindu University, Varanasi. At present, sir is working as Associate Professor and HOD, Department of Vikruti Vijnana, Banaras Hindu University, Varanasi. Sir had total 18 years of teaching experience in the field of Ayurveda. He is a resource person for many seminars and lectures. Sir has presented many scientific papers and published 131 scientific articles in national and international journals. And sir has published 27 papers and published 11 books and 30 chapters in this book. Under his guidelines, 15 research products were completed. Sir has many awarded, among them Pure Excellence in Ayurveda Award in 2014
Conclusion.
and Best Book of the Year World Award for Textbook of 2015. Roganidana Visharada Award for Excellence in Ayurvedic Teaching in 2016 and Mahima Young Scientist Award by the Institute of Agriculture Science, BHU in 2016 and many more awards to his.
Shall I start my speech?
Sir, over to you, sir.
Okay, thank you. I am very much thankful to the principal Lingareddy sir and Chaya madam and whole organizing team for selecting me as a chief guest for the 2 days webinar program, which was exclusively on the Vata Vyadhi and its management. There are four lectures I was hearing since yesterday, starting with Prasanna and Mogusale. So he was giving a comprehensive description about the concept of Pakshagata and its possible correlation with the concepts of modern medicine and how it can be interpreted with the Ayurveda with that of the modern medicines. So that lecture was also covering the entire classical references mentioned in Ayurveda with the present modern era descriptions pertaining to the stroke ischemic and stroke hemorrhagic. So there was an extensive pathophysiological description along with the diagnosis possibilities at the initial phases, how it can be diagnosed and how it can be managed. It was a very wonderful informative lecture. Followed by today morning, there was a lecture from Dr. Shalini Rai. She did a very beautiful concept on the Vata Vyadhi and its understanding with the enteric nervous system and with the entire pathophysiology of Vata with the understanding of the neurological concept. So she was also made an attempt to make you to understand the concept of what has been mentioned in the various classical texts, how it can be interpreted in the language of science, in the language of the medical words. So she made a good effort to make you to understand. So it was very useful and excellent information provided by her. I hope you might have enjoyed that. So the third lecture was by Veena Madam on the Parkinsonism disease and Kampavata. So everybody know that it's a neurodegenerative disorder affecting the basal ganglia, and it is very difficult for the management. Even then, certain medicines are available in modern medicine, but still it is not completely effective. So Ayurveda has a lot of scope in that. So she made an attempt to make you to understand how it can be well managed with the concept of Ayurveda, starting from the Samshamana to that of the Samshodhana therapy, how these can be interpreted to get rid of the disease Parkinsonism disease. And today afternoon, one of our good friend, my senior, Dr. Madhav Digavi sir, he actually was supposed to start by 2:30 because there was a problem with the connectivity. So he started by his lecture by 3 p.m. So he made an excellent effort to make you to understand the spinal disorders, how it can be understood by the descriptions of Ayurveda with that of the modern medicines. And to make you to understand the whole set of neurological Vata Vyadhis in terms of its pathophysiology and how it can be diagnosed. There are various classical neurological examination tests he narrated, he beautifully described with the pictures, and it was, I hope it was very useful information for the students. And lastly, he was giving more focuses on the treatment modalities, how it can be treated and how it can be managed with the Ayurvedic treatment, and how the approaches can be made with a single. There is a pain in the cervical region, but how it can be correlated and what may be the possible positive factor for the development of the cervical region pain, and he was trying to establish the interrelation between the lumbar spondylosis with that of the cervical spondylosis, along with the various the pains developing at the various trika sandhis. Of course, it is a very evident that everybody is accepting that there was a situation developing the because of the association of the vata along with the ama. So that was mainly responsible for the development of such kinds of pain, but that can be managed appropriately with the appropriate therapeutic measures. So the all the four speakers delivered the wonderful lectures with provided the entire wonderful information pertaining to the Vata Vadis as well as the Parkinsonism disease. So as you know that there are challenges with us, there are challenges with the modern medicine also for the understanding of the Vata Vadis. Everybody is accepting, Ayurveda is also accepting that so this particular vata is responsible because of its dependence and eternity, and because of its all pervasive nature. So this particular vata is worshipped all over the world, That's the reason which has been sarvaloko namaskutaha, that kind of word which has been given to the vata because this is the responsible for sthiti and utpatti or vinasha. Sthiti, utpatti and vinasha is all dependent on this particular vata. So that is why this particular vata needs to be understood. Again, further he says that Susruta says avyakto vyakta karma. This can be understood by avyakto, but it is in the form of avyakta, but this can be understood by the vyakta karma, by the what the effect can be given to the body. Based on that can be understood. Along with that has been mentioned that ruksha, it is sita, and lagu karaha, this all you know that. But because of its direct and vigorous chaiva, because of this rajo shabda and sparsha guna pradhana, along with that it is moving haphazardly in various directions. Because of its minute nature, sukshmatva, it can penetrate and it can enter into the minutest and minutest stula and sukshma. It can enter into the even stula as well as sukshma srotas. And this, because of this rajo, it is also in rajoguna dominant this thing. So and achintavirya doshanam, achintavirya, it has the word been used, doshanam netaha roga samhara. This kind of word has been used. So it means that it is very difficult to understand and pursue the efficient functions of vata and where it goes, how it goes, and what maybe there are certain mechanisms, there are certain pathophysiological procedures we are not able to understand till date. There are diseases, even in modern medicine also accept that unknown. Even Ayurveda also accept that there are certain diseases manifest, we don't know the causes. Ayurveda also accept that particular thing. So that in this particular Vata Vadis are considered to be an Roga Samuharat. It will be an king of all the diseases. Another important thing which has been mentioned for Vata Vadis is Ashukari in nature. It develops very instantaneously. That's not the case. That's not the case with Kapha and Pitta Vikaras. Before the development of these two diseases, there will be an premonitory signs and symptoms. There are some warning signs and symptoms will develop prior to the manifestation of the diseases. But that's not the case with that of the Vata Vadis. So that is why the management of this Ashukari, Muhuchari, that again, this will frequently moving here and there, and it will manifest again and again. And again, this particular Vata Vadi is taking a route from the Pakwadana Udalayaha. So that is the reason Vata Vadi management should be done. Basti is one of the standard treatment. Basti is one of the best treatment among all the treatment modalities for the control of the Vata. So if the person who is well trained, well equipped with the knowledge of Basti management, by using the various combinations of the drugs, so that he or she can develop a mastery in controlling the Vata Vadis. So Vata Vadis are developing innumerable number of Vata Vadis. That's the reason again further Vagbhata Madhukosha says that Vayor Atibalattvena, Ashukaritvena, Gariyastvad, Visista Chikitsatvad, Dusadhatvad. So these kinds of statement which have been given. So when you are managing the line of treatment for Vata Vadis, you need to plan the line of treatment with utmost precautions. You should understand the dosha, You should understand the, again in the dosha, you have to understand Dravetaha, Karmataha, Gunata, Ruddhi, Kshaya of that particular dosha needs to be understood. And then followed by, you need to understand the Sampradhi Ghataka in total. Along with that, you should go for the understanding of the Prakriti of the patient is also very, very important. You should understand the Sara of the patient, Sattva of the patient, Sattva, Satma, the Vikruti, Prakriti, Vikruti, Sattva, Sara, Sammanana, Ahara Shakti, Vyama Shakti, and Pramana Pariksha. All these things are very, very important. Based on that, you have to decide the dose, how much dose medicine has to be administered. Because why the same physician is getting a result and the another physician is not getting the result, it makes you to difference, because when you are planning the line of treatment, you should always consider the Charakukta Dasveda Pariksha or Susrutukta Dwadasveda Pariksha. Both are saying the same thing. First, try to understand the Rogi Bala and Roga Bala. If you are able to understand the strength of the disease and strength of the disease as well as strength of the person, based on that, you need to plan the line of treatment. If you fail to understand the strength of the disease and strength of the person, if you are administering the disease without considering these two, it may end up with the failure in the line of treatment. So that is why, if the person's strength is good, so you can go for strength of the patient is good, and if the Vadi is Pravala, then you go for the Samshodhana Chikitsa. That is badly needed to eliminate the doshas from the Pakvashaya, so that Vata can get strength out of it. If the doshas, if the Vadibala is Madhyama and the patient strength is also Madhyama, then you can go for a Samshamana Chikitsa with Mrudu Samshodhana Chikitsa. If the Vadibala is Pravara, but the Rogibala is Avara, then in that particular conditions, based on the Rogabala Pravara, that particular patient needs to be managed with Samshodhana Chikitsa. Because of the Vadi Rogibala Avara, so you cannot administer the Samshodhana to that particular patient initially. So in that particular condition, start with the Samshamana along with the Rasayana medicines. So you have to enhance the strength of the person gradually, then start with the mild Samshodhana therapy, so that the patient can get the little strength to overcome the effect of the Samshodhana therapy. So that is why when you are planning any the line of treatment of these diseases, especially in Vata Vadis, you need to be very careful when you are analyzing these factors. So the understanding of the doshas, dushas, rotas, agni is very paramount important. So based on that, if you're planning the line of treatment, I hope it will be very useful. There was in time the people were saying that how the people are saying that how Ayurveda says that sarve piroga manda agnam sutaram udaranece, or agni is the Agni Mandata or Agni Mardavata or Kayagni Durbalita is the base of the root cause of the development of most of the diseases. So now the people are coming up with the theories that gut leaky mechanism, as Dr. Shalini was highlighting that particular theory. Nowadays, you can understand that what is the importance of this particular gut leakage theory mechanism, how it is going to helpful the dosha situated in the majja, that can be removed through by the purgation therapy or by the panchama or by the basti karmas. So there will be Majjadara Kala with the like that. There will be correlations with that of the Pittadara Kala with that of the Majjadara Kala. So that combinations of the correlations have been given in the classical texts of Ayurveda to manage these kinds of patients. So that is why the understanding of the concepts of Ayurveda from the point of view of this Vadi Samprabdik Vivechana, Ghataka Vivechana is very important. Accordingly, if you plan the line of treatment, I hope you are going to get success. There are problems with Ayurvedic concepts or Ayurvedic, the problem with Ayurvedic Siddhanta or Ayurvedic problems is Ayurveda is basically explains most of the subjective phenomena and subjective criteria. So you need to take the help of the modern medicine to understand the objective criteria to make you to understand the what maybe the, for example, if somebody is suffering from a cervical, it has been told as cervical spondyloid or the cervical pain. So you need to understand there is a shula is mentioned in Ayurveda, but that particular shula in Ayurveda, it has been mentioned in the two broad headings. We can understand. One is that shula may be because of Dhatukshaya Jana, or that shula may be because of Bhargavarna Jana. So that needs to be, and again in the Dhatukshaya, which Dhatukshaya is there. So that I think Dr. Madhav Diggavi was giving a more focus to that, make you to understand what are the things to be taken care to make you to differentiate the Dhatukshaya-janya Vatavyadi and Margavarna-janya Vatavyadis. So once you are able to understand the Dhatukshaya of which Dhatu Shaya is there or which Dhatu deformity is there, and that is causing the Vatavyadis. And if you're managing the line of treatment accordingly, I hope you are going to get the wonderful result. There is no doubt in that. That's the reason Visishta Chikitsatva, that has been word which has been used for the in context to the Vatavyadis. So that is why you need to be very, very careful when you were choosing the line of treatment for the Vatavyadis. Again, it has been told in context to the Vatavyadis. Vata is responsible for the transmission of the nutritional portion. That Vanavata is which is responsible for the circulation of the whole nutrient portion to the different portions of the body, and accordingly the different body portions will get the nutrition, and then they will get this the good results out of it. So when you are managing the line of treatment for Vatavyadis, so you need to take these kinds of things into consideration. I hope this 2 days webinar has provided you a lot of information to understand this particular Vatavyadis, especially this Pakshagata and the neurological disorders of the spine, how it can be understood, and the Parkinsonism disease. And these are all the things which have been very widely discussed with utmost experience by the experienced faculty from the various parts of the India, delivered a good lectures. So I wish all the best, and I'm very much thankful to the Principal Lingareddy sir and Dr. Chaya madam and whole team of the Gramin Ayurvedic College Tirdal for organizing such a very wonderful webinar program. I hope you continue with the same webinar program so that the students who are studying in your college or maybe in other parts of India will get benefit by hearing the expert lectures from the experts of Ayurveda. So thank you one and all.
Thank you, sir, for a valedictory speech. Despite your busy schedule, you accepted our invitation. Thank you, sir. Now I request Dr. Chaitanya madam for organizing speech. Over to you, madam.
Hello. Hello. Am I audible?
Yes, ma'am.
Om Shri Gurubhyo Namaha. Om Dhanvantare Namaha. Warm greetings to one and all. Myself, Dr. Chaitanya, Associate Professor, Department of Roga Nidana, GMC Tirdal, on behalf of the organizing committee of AYURVATA CHINTANA 2020, would like to speak a few words. The world is facing humanitarian crisis because of COVID-19 pandemic. We all are continuously trying to overcome this difficult situation. We are working together. Still, the lockdown is on, but the learning has not stopped. As it is said by Acharya Charaka, Satata Adhyayana, Adhyapana, and Tadvidya Sambhasha are the means of gaining knowledge. To implement this, in our college, we are organizing webinar programs since June 15th related to different specialties. As a part of it, we from the Department of Roga Nidana also thought of conducting a webinar. For this to happen, our management has provided us with all the requirements and they have supported us in all the aspects. We are blessed to be managed by such a congenial, thoughtful and respectful management committee. We are extremely grateful to the chairman, Shri D.C. Patil sir, secretary Dr. J.B. Algur sir, treasurer Shri Nilesh Desai sir, and all the members of the management committee. Then why we have selected Vatavyadi as a subject? Because in clinical practice, we get n number of cases related to Vatavyadi. At times, we do face difficulties in appropriate diagnosis of this mysterious disease. As it is said by Acharya Sushruta, Vikaraha dushparimrshtascha mohayehu chikitsakam. The diseases which are not diagnosed properly are going to confuse the patient and going to confuse the physician. So we thought this would be the apt subject for discussion. Accordingly, a meaningful name was suggested by our principal, that is AYURVATA CHINTANA. Then we communicated with our resource persons who are not only good in subject, but also they really practice what they teach. All the speakers, Dr. Prasannan Mogasale sir, Dr. Shalini Rai ma'am, Dr. Veena G Rao ma'am, Dr. Madhav Digave sir, wholeheartedly accepted our requisition. In spite of their busy schedule, they have managed to give us their precious time. I sincerely thank all the resource persons for showering us with the pearl of their wisdom. They literally did Gnanavriddhi and cleared the avarana, what we had regarding Vatavyati. Thank you. We look forward to listen from you once again, madams and sirs. With all our due respect, I would like to thank Dr. Sayadatar Fatima Madam, Principal, Government Tarnath Government Ayurveda Medical College, Ballari, for inaugurating the program and delivering the keynote address. Thank you, ma'am. We are delighted to have Dr. Parameshwarappa S. Byadegi, sir, Associate Professor, Department of Vikriti Vijnana, Institute of Medical Sciences, Banaras Hindu University, Varanasi, as the guest for our valedictory function. I extend my heartfelt thanks to you, sir, for gracing the occasion and shedding some more light on the topic. Above and beyond, my deepest sense of gratitude to our beloved principal, Dr. L.M. Biradar, sir, who, like Prakritavata, is the driving force and the motivation to all of us. He is visionary and the person who gave us belief to bring together this webinar. Thank you very much, sir. No event can take shape without hardworking coordinators. It is the dedication and enthusiasm of our coordinators made this webinar a successful one. Thank you, Dr. Chaya Huller ma'am and Dr. K.V. Kullur ma'am. I must mention our deep sense of appreciation for all our faculty members who supported in conducting this webinar. Special thanks to Dr. Vinayak Malli sir, Dr. Anand Kuntalli sir, and Dr. Shrikant Vislawat sir. A big thanks to all the non-teaching staff, hospital staff, for their timely help in smooth organization of this webinar. I would like to thank all our students for their active participation in this webinar. Furthermore, a special recognition to all the delegates who remained patient throughout and encouraged the morale of the speakers by their enthusiasm. Thank you so much. With these few words, thank you for giving me the opportunity to speak on behalf of Dr. Mike. Thank you, one and all.
Thank you, ma'am. Now I request our beloved principal, sir, president of this webinar marathon from Government Ayurvedic Medical College, Tirda, Dr. Lingareddy M. Biradar, sir, for a presidential speech. Over to you, sir.
Good evening to all. Respected Chief Patterns, President of this Institute, Sri D.C. Patil sir, Secretary of Gramin Ayurvedic Medical College, Dr. J.B. Alur sir, and Treasurer of this Institute, Sri Nilesh Desai sir, my respected Gurus, Chief Guest of this function, Sri Parameshwarappa Byadegi sir, and Fatima Madam, and all my colleagues, and Madhav Digave sir, and coordinator of this function, this webinar, Chitna Pujari Madam, and organizing secretary and coordinators, Dr. Chaya Hiller Madam and Kullur Madam, and all my staffs. So here, since 2 days, we are in this Vata Ayurvata Chintana webinar. So since last July 15th, we are busy in hosting these all the continuous webinars from Department of Kaya Chikitsa, Shalya Tantra, Panchakarma, then Shalakya Tantra, Striroga Prasuti Tantra, then Roga Department. So I can take this opportunity. First of all, I'd like to thanks to our management for providing a platform to host this online webinar in the propagation of science of Ayurveda. So apart from this, I take my sincere thanks to Dr. Sayeda Fatima Madam, Principal Government Ayurvedic Medical College, Ballari, as participated as a inaugurator and given the keynote address really, with deliberations on Vata Vyadhi. And I also especially thanks to Dr. Parameshwarappa Byadegi sir, who is watching since from the inauguration to till the end. He is always in the session with us and made the good deliberations at the end also with the good conclusions in the for the Society of Ayurveda fraternity, who has always motivating us for their constant support for us all the way. I am very much thankful to you, sir. And I am also thankful to take this moment to all the speakers who has participated and shared their views deliberately, especially Dr. Prasanna Mursale sir, Dr. Shalini Rai madam, Dr. Veena G. Rao madam, Dr. Valedictory sir, delivering and sharing their knowledge for all the students and PG scholars and practitioners, and made the this webinar grand success. And not but the least, I'm also thankful to all the teaching staff who have since worked from last July 15th for all the webinars, supported all the way on the screen and off the screen constantly with their dedication. And all the non-teaching staff who have provided us this technical support for all the webinars, and all the other participants who have supported us with their constant registrations, feedbacks, good inputs, and motivations for us for hosting these webinars. And I also request all the speakers, this is the initiation we have took. We also want this support in future days also, as the Parmeshwar Paddy sir told. So this is the good platform to prepare the science of Ayurveda for all the students of Ayush right now in the pandemic condition of COVID-19. So I am very much thankful to you, sir, and we are also eager to host the few more webinars on the different departments. We are planning right now. I need your support in future days also. With this, I conclude once again. I especially thanks to all the chief guests and e-inaugurator sir and e-valedictory who have participated, and all the participants. Thank you one and all.
Thank you, sir. Thank you.
Thank you, sir, for your wonderful presidential speech. Now I request Dr. Chaya Ullur madam for a vote of thanks.
Thank you, sir. I would like to thank management team of our college and patron of this webinar, Shri D.C. Patil sir, Chairman, Gramin Ayurvedic Medical College, Tedda, Dr. J.B. Albur sir, Secretary, Gramin Ayurvedic Medical College, Tedda, Shri Nilesh J. Desai sir, Treasurer, Gramin Ayurvedic Medical College, Tedda, giving us an opportunity for this wonderful webinar series. On behalf of entire institute, I would like to extend a special thank to e-valedictory guest Dr. Parmeshwarappa S. Badgi, sir, Associate Professor and HOD, Department of Vikruti Vijnana, Institute of Medical Science, Banaras Hindu University, Varanasi. Thank you, sir. I would like to thank our e-inaugurator of this webinar, Dr. Syed Akhtar Fatima ma'am, Principal, Gramin, Taranan Government Ayurvedic Medical College, Ballari. Thank you, ma'am. I would like to thank our beloved principal, Professor and HOD, Department of Panchakarma, and President of this webinar, Dr. L.M. Birada sir, Gramin Ayurvedic Medical College, Tedda. Thank you, sir. I would like to thank Organizing Secretary of this webinar, Dr. Chaitana Pujari ma'am, Associate Professor and HOD, Department of Roga Nidana, JMC, Tedda. Thank you, ma'am. On behalf of entire institute, I would like to extend a special thanks to all guest speakers, Dr. Prasanna N. Mursale sir, Associate Professor, Department of PG Studies in Roga Nidana, STM College of Ayurveda, Udupi. Thank you, sir. Dr. Shalini Rai ma'am, Assistant Professor, Department of Roga Nidana, All India Institute of Ayurveda, New Delhi. Thank you, ma'am. And Dr. Veena G. Rao, madam, Department of PG Studies in Panchakarma, JSS Ayurveda Medical College, Mysore. Thank you, ma'am. And the speaker, Dr. Madhav Digavi, sir, Professor, Department of PG Studies in Kaya Chikitsa, Taranand Government Ayurvedic Medical College, Ballari. Thank you, sir. I would like to extend my thanks to our teaching staff, non-teaching staff, hospital staff, and students of GMC Terda. Thank you, one and all. Over to Dr. Shrikant, sir.
Thank you, ma'am. So today we are going to conclude our this webinar with this famous quote. To accomplish great things, we must not only act but also dream, not only plan but also believe. With this course, we are concluding our webinar marathon from Gramin Ayurvedic Medical College, Tirda. Stay with us and stay tuned for more updates. Thank you.